Hello, everybody, and welcome to Live with Dr. McDougall. That's the name of the webinars that Dr. McDougall is doing every Thursday at 11 in the morning Pacific time, in which he talks about a topic and then answers your questions. And today his topic is cancer, and more specifically breast cancer. We have a lot of good questions, and I welcome Dr. McDougall and his wife, Mary McDougall, co-founder of the McDougall program. Thank you for being here today, Dr. McDougall.
Well, thank you. I tell you, I'm looking at the screen, and at least one half of the screen, I can say there couldn't be a more beautiful couple.
There couldn't.
And just to mention that, Mary and I are trim, and it is because we eat the McDougall diet. And I can show you this letter. I got a letter from somebody, an email, and I've kept it because I found it precious. It says every time that they see us, we look younger and healthier.
Younger and healthier.
Yeah, and
that's the idea, right?
Yeah, I like hearing like things like not people coming up to me and saying you're too skinny,
Yeah.
or isn't Mary losing too much weight, and I tell them, look at all of our staff. Heather, our director, she's thin. Doug Lyle's thin. Jeff Novick's thin. Alec Isabeau's thin. Anthony Lim's thin. I mean, we're all thin. I wonder why. Is there a coincidence?
Anyway. Well, it wouldn't be a very good advertisement if everybody was overweight, wouldn't it?
It would be terrible. As a matter of fact, it would say poorly. And I see this all the time with diet doctors. Those on TV and those that are in the area, I see them, and they have a wheat belly. That's one diet doctor out there. Yeah, they don't look good. I didn't want to start out that way. I invited Mary in just for the first couple of minutes of our webinar for two things. One, Gustavo asked her if she would come in next week and do some holiday planning suggestions. And what did you say?
I said I would.
Okay, reluctantly.
Reluctantly.
And the other thing is Mary's still putting together the trip for Hawaii. We've got a large group of people coming, but she still has some rooms
some
for the
oceanfront rooms.
ocean. And these are not ocean view; these are oceanfront. You're like right on the ocean.
Right on the ocean.
So that's in Kauai, and what is it? January 30th, 2000.
January 30th to February 6th.
And it's going to be a great trip. Mary and I will be there the whole trip. I have a chance to get lectures every day, and I have a chance to get to know people a lot better than I do in any other situation. So we invite you to go to the website to find out about the Kauai trip, Kauai, Hawaii. If you're thinking, well, you're going to do it with us next year, forget it. It's not going to happen.
It's not going to happen next year. This is it.
This is it. We've been to Hawaii 3 times. I think if we do more trips next year, we have one for Alaska scheduled. If we do more beyond there, and who knows how life changes, we will be going to some other place, maybe a little bit more domestic. Gustavo, you had a video that the hotel sent to you. Could you play it for us?
That's right. So we will play a 2 or 3 minute video. Just everybody, don't be afraid. Your screen is. We are going to disappear, Dr. McDougall and myself, and the sound, and you will be able to watch this video that shows the motel, the hotel.
The motel. It's a resort, Gustavo, and I heard that you might be coming with us.
Yes, I am really working hard at trying to go to this wonderful motel. And, Hotel Sheraton. So here is the video, everybody, okay?
So doesn't that look like a beautiful place?
That is absolutely breathtaking, and it already made me hungry.
And the interesting thing, as we talked about last time, is they really took very good care of Mary and I. We were there a couple of weeks ago just to try out the food. We always do this, check things out, make sure it's going to be okay. And the things that they prepared were phenomenal. My guess is when we leave this resort, it's going to be at the top of the resorts that we visited, which have been many over the last 23 years. So the food's the reason to go. I mean,
well, the beach is pretty nice too.
Yeah.
having a little time to spend together is good. Meeting nice people.
The adventures are pretty great too.
Yeah, the adventures, you have lots of adventures.
Well, and the opportunity for people to meet both of you and to have the chance to visit with you and get to know you better, I think it's one of the big.
Yes, it will be.
Yeah.
Anyway, we hope you can join us in January. Go to the website or call the 800 number. You get more information. Thank you, Mary. Next week we'll hear a little bit about.
We'll talk about food next week.
Okay. Well, the subject today is cancer, and I have done a lot on this subject, and I'll explain to you what I've been through over the last almost 40 years with the subject of cancer. If you want to find out more, what you would do is you would go to my website and do a search. You'd look in the videos. I think I have a video that contains some of the presentation I'm going to give you now. Plus, my February 2015 newsletter is very important. Let me start a little bit of slideshow here.
Okay, sure.
With you. And the February 2015 newsletter really gave me a chance to show people, all the things that I've learned over the years. What I'm going to share with you now is just a segment of that information. So if you want to learn more, it's all on the website. It's all free. The first thing I need to explain to you, this is a concept I'm really putting forward too far early, but I must, is how cancer grows, and then you'll understand why it's so difficult to treat and so-called prevent. Cancer starts as a single cell. You see that single cell off to the left side of your screen? That's one cell that stops obeying the rules. It starts doubling at its own free will. Now that cell is lurking in a mass that contains 100 billion cells. There's 100 billion cells in a breast or 100 billion cells in a prostate gland. We're going to be limiting this to breast cancer primarily. So you got one cell amongst 100 billion that starts to spread at its own free will. And it's starts to divide its own free will. The average dividing time, which we call doubling time, is every 100 days or 3.5 months. So after 3.5 months, you've got 2 cells. Another 100 days later, you've got 4 cells. As you continue to divide, you see that by the time you had cancer for a year, you have only 8 to 12 cancer cells lurking in a breast that contains 100 billion cells. At that stage, at about a year, what happens is cancer spreads. If it's going to spread, it spreads to the liver, lungs, bones, and this is called metastases. And it's these metastases that kill. It's the spread of the cancer cells to the brain, lungs, and liver, and so on. It's not the breast cancer that kills. So the divisions continue, and finally you've had cancer for 2 years, and now you've got about 100 cells in this tumor mass, undetectable. The divisions continue at an average of about every 100 days. That's the average doubling time. And by the time the cancer's been there for 6 years, it's a millimeter in size. It contains 1 million cells, and it's not detectable by any means. And yet you've had cancer for 6 years. The divisions continue. Now you've had cancer for 10 years. Your tumor mass is the size of an eraser of a pencil. It's 1 centimeter in size, about 1/2 inch. It contains 1 billion cells. If you understand this natural history of cancer, then you understand why screening, in other words, early detection, mammograms, PSAs, etc., can't work. You're looking at late disease, not early disease. The tumor mass has to grow to 1 centimeter before the PSA level starts to rise. This is late disease. You've had cancer for 10 years. Mammography actually detects cancer on average later. It detects the cancer after it's been growing, say, 14 to 17 years. And that's because the fast-growing cancers are usually picked up by the women themselves, and only the slower-growing cancers are more likely to be found by the mammogram machine. Now, with this in mind, I have to tell you some optimistic news that's going to continue throughout this presentation. The optimistic news is I gave you the average doubling time of every 100 days. That's average. Some women, their tumors grow much slower. Their doubling times may be every 300 days or every 500 days. On the other hand, there are some women's tumors that double fast. They may double every 24 days. That's not good. The important thing to understand is these doubling times are variable and, I believe, controllable. And of course, the factor you use to slow down the doubling times is the diet. And there's good evidence to say that what I'm talking about is true. So you want to slow those doubling times down so that, you know, instead of dying of breast cancer in 3 years, you die of breast cancer in 18 years. You know, I'd like to have every one of my breast cancer patients die on their 96th birthday by slowing the doubling times down and being healthy. All right, that's a very basic but important part of the information about cancer that you need to have for us to continue the conversation. I want to introduce you to the Cochrane Collaboration. They are the most respected body of scientists to deliver scientific and medical opinions to the professionals in the world. 28,000 volunteers. They're in 100 different countries. Well, this collaboration is headed by a guy named Peter Grutze, and he happens to be a friend of mine. He came and talked at our clinic. He wrote a book called Mammography Screening, Truth, Lies, and Controversies. Anybody who wants to understand the scientific information, have a very detailed explanation of what is going on, I encourage you to get this book. You can get it off Amazon. His conclusion, and that of the Cochrane Collaboration, and this book, is that mammograms do not save women's lives. They increase the number of women that are overdiagnosed, and they increase a woman's chance of having a mastectomy. Well, because of these conclusions, the Cochrane Collaboration put out in 2012 a brochure written in 13 languages sent around the world telling women not to get mammograms, officially not to get mammograms. What the Cochrane Collaboration found and put in their report that led them to say not to get mammograms is that if 2,000 women are screened regularly for 10 years, one will benefit from screening as she will avoid dying. At the same time, 10 healthy women, as a consequence, become cancer patients and will be treated unnecessarily. This figure I have seen as high as 50. In other words, 50 women will be told they had breast cancer, and it wasn't the kind of breast cancer that would kill them, or they would die of something else before the breast cancer became lethal. So one life is saved. Let's say between 10 and 50 are diagnosed with breast cancer and are treated unnecessarily. Furthermore, 200 healthy women will experience false alarms. If you get a mammogram done at the recommended recommendations of having one done every 2 years for 10 years, then you have a 50% chance of being found to be abnormal and have to go under other tests, treatments, and so on. Physicians really don't understand screening. You get a lot of misinformation, and if I can go through this with you slow enough and simple enough, I think it'll be worthwhile and make a lot of sense to you. In this report in the Archives of Internal Medicine, investigators went out and they asked doctors what they understood about mammograms. And most primary care doctors mistakenly interpreted improved survival and increased detection with screening as evidence that screening saves lives. Now, I want you to just look at that for a minute. Doctors believed that improved survival is a benefit and finding more tumors is a benefit. But this is incorrect, and I'll show you in just a moment. Few correctly recognize that only reduced mortality in a randomized trial constitutes evidence of benefits of screening. In other words, you have to save lives. All right, here goes. Improve survival. Here's how you improve survival with a mammogram or other screening tests. You see over to your right, the day of death, 0. If you count back in the years, say 3 years before you died of breast cancer, you found the tumor, and you probably found it just by casually examining your breast. Then you were considered not to be cured because this usual past definition of curing yourself of cancer is you have to live 5 years. Well, if you only find it 3 years before you died, you weren't cured. But if you were diligently looking at your breasts with all kinds of screening techniques, x-rays, ultrasounds, etc., and you found your tumor Look at the day you die, that's 0. If you find your tumor, say 6.5, 7 years before you died, you were considered cured and you survived longer. But you died the same day. You just lived longer knowing you were sick. The businesses that really benefit from early detections are the ones that sell treatments and tests, because they have a patient instead of a patient for 3 years. In this case, they have a patient for 6.5 years. So the idea that improving survival, in other words, the length of time from diagnosis to death, is a benefit is false. It's called lead time bias. Overdiagnosed. Doctors believe, and I just told you, the doctors were asked, they said finding more tumors is a benefit from mammograms. Well, if you look hard and you do all kinds of tests, you'll find more tumors. You see the day of death, and you do an autopsy after the day of death, and you find a whole bunch of tumors then that would have not been there if, say, 5, 6, 7, 8 years before, doctors were in there taking the tumors out. They'd find all these tumors. You die the same day as you would if they left tumors in the body. So finding more tumors is not a benefit. The only true benefit is, as they say in a controlled trial, the group that's screened. There need to be more people alive compared to the group that doesn't give screening. And when tests are done, large tests for PSA, prostate cancer, tests for breast cancer, these colon cancer, these various screening tests, they can show things like we find more tumors. Yeah, you do. You find more cancers. And you can show that people live longer after finding the cancer. That's because you found it early. But you don't see people screened living longer. All right. If you look at my August 2014 McDougall newsletter, you'll see the screening tests that I do recommend. There are a few screening procedures that I think are worthwhile, like pap smears under certain circumstances. Colon polyps, I think you should check your intestine with a screening test, maybe around age 60. And when the dentist is looking in your mouth, I think that's a good idea. If anything suspicious, be brought to your attention. And if you see any obvious changes on your skin that would suggest melanoma, then you'll want to follow up with further testing there. But there are details in the August 2014 newsletter that'll help you understand what screening tests I recommend for my patients and which I don't, and why. All right. Now, I told you about the doubling time. I told you this is a late disease. The problem is the cattle are already out of the barn before you close the door. The cancers that are going to spread have already spread. And by the way, this was a subject of today's New England Journal of Medicine. And I'm going to be writing about this in the newsletter that comes out on Monday. The fact that the cancers that are going to kill people are already established long before you detect it. The American Cancer Society came out this year and told us that there's been virtually no change in the death rate in cancers of men and women over the last 50 years, 40 years, since 1975. There have been virtually no changes in mortality. With all the talk, really, there's been very few new treatments. With all the talk about how well we're doing, if you look at the actual statistics that came out by the American Cancer Society this year, we're not making progress. What about diet? Should we be thinking about diet in terms of helping our patients? Well, the idea that breast cancer was tied to diet came out first in a British Journal of Cancer article published in 1969. It was noticed, for example, with breast cancer, if you look at the dietary patterns of people around the world, you'll find that the more fat that they consume, the more breast cancer that they get. There have been multiple animal studies that show fat promotes cancer. And one of the most shocking things that I want you to hear me say is that vegetable fat is a stronger promoter of cancer growth than is animal fat. So these polyunsaturated fats you've been using for years, the safflower oil, the corn oil, et cetera, these are really, really strong cancer promoters, even more than would be lard. This is just one of the studies that shows that. Okay, let's go here. Back in 1979, you can imagine, I'm not trying to brag, but I put together the dietary guidelines for cancer when I lived in Hawaii. I sent these dietary guidelines to the American Cancer Society, and they wrote back and said that our group was premature in our thinking. The guidelines are the ones that they eventually adapted themselves about a year later, and the ones that everybody knows about. You know, in fact, there was a report just last week from the World Health Organization that says that eating beef, particularly processed meats and other meats, cause cancer. That was 1979. Let's see, that was a long time ago. The U.S. dietary guidelines were established in 1982. And these things are publicized in the media, and then they're forgotten, just like the World Health Organization report that came out last week. It made headline news for a couple of days, and it will be forgotten. And the meat industry will just go on their merry way. I want to introduce you to this man. He was a friend of mine. His name's Ernst Winder. And Ernst Winder is actually the man who discovered the relationship between cigarette smoking and lung cancer. And he went to the Sloan Kettering Institute, and he said to them, I believe smoking cigarettes causes lung cancer. And they said, nah, you got to be kidding. He said, no. He says, you put this tube in your mouth filled with tobacco, and you suck on it, and you get lung cancer. Well, a few years later, everybody seemed to think this was the case. Then Ernst Winder went back to Sloan Kettering and said to them, I believe that what you eat, particularly beef and other animal foods, what you eat causes colon cancer. And the experts there said, no, how could that be? He says, well, you put this food in your intestine and it causes colon cancer. Anyway, this has been talked about for many, many years. Ernst Winder also showed that people who have cancer, who eat healthier, live longer. I mean, think about it. You know, if you stop throwing gasoline on a fire, isn't that a good idea? If meat and dairy and oil causes cancers of various kinds, even after you get it, doesn't it make sense to stop consuming those foods? Anyway, what happens is you slow the doubling time. As I mentioned before, I believe with a good diet, you becoming healthier, you can slow those doubling times and live longer. That belief was established in February 13th of 2015, officially, when the American Cancer Society recommended to the public that those people who have cancer of the colon, breast, melanoma, all kinds of cancers, they need to change their diet because it will improve their ability to survive. That's what the American Cancer Society finally told us. Up to Date is a resource that doctors look at for the best information. They made the same recommendation. If you have cancer, you need to change your diet because you'll live longer. There's a patient who had cancer all over her body, published in the Journal of the American Medical Association. Cancer completely cleared up. There are such things as spontaneous remissions, colon cancer, published in the Journal of the American Medical Society. All kinds of, here's a study that was just published that showed that 22% of invasive, these are not non-cancer, DCIS, but 22% of invasive cancers disappeared in a 6-year period of time. I've had many notable patients who have changed their diet, who I believe have also changed their life. You can find these people on my website. All right, so I think that's probably enough of that, Gustavo.
Very good, Dr. McDougall. Every time I see your presentation, it's an absolutely just.
Well, there's so much more I'd like to share.
Right.
But people who are interested, at least I touched on a few things that will cause people to be interested. You should note that October is Breast Cancer Awareness Month.
Right.
I'm sending out as part of the newsletter that goes out on Sunday or Monday, the fact that this month there have been 3 major articles published that relate to the things that I just told you. One is the American Cancer Society is now recommending women get fewer mammograms because they realize that these mammograms do little good and much harm. In another article, which is in JAMA Oncology, there was a big study published on about 100,000 women that showed that there's no survival benefit in treating a type of disease called DCIS, ductal carcinoma in situ, or stage 0 breast cancer. There's no survival benefit at all. And these women have been unnecessarily treated. That came out this week. All these made major headlines in papers all over the country. And then there was one today in the New England Journal of Medicine that was authored by my good friend H. Gilbert Welch. Any of you who've been to the Advanced Study Weekends, you know H. Gilbert Welch. He's been a guest at our weekends on at least 3 occasions. And in there, it says just what I told you, that cancers destined to kill are present before people find them. I mean, the history of the disease is already established. So anyway, you can at least I hope I've wetted your lips so that you can see that that what you're being told is not true. And you can also see as you read this, as you listen to me and you read the stuff that I've written, is we've known about this for 40 years. In the newsletter that comes out on Sunday or Monday, I actually put in a PDF file of a chapter I wrote in 1984.
So if this information has been known for 40 years,
Yeah.
why do you think that it's still so difficult?
Well, it's always the same thing, and I have to be careful that people think I'm involved in a conspiracy theory. It's always the same thing, is the money rules. You think about all the suffering that women and families go through, having chemotherapy, breast amputation, even death. Even things as important as worry and fear when you go to get a mammogram. All this terrible suffering that goes on pales to the billions of dollars that are made in these industries. It's not a conspiracy. It's just plain and simple the way people act. You know that book I showed you by the head of the Cochrane Collaboration, Mammography Screening, Truth, Lies, and Controversies?
Right.
I gave that book to a friend of mine, a fellow by the name of Jack Forrest, who was head of radiology at UCLA. When I came out, I gave it to him, and I said, "Jack, read this." And he came back to me. He says, "Great book, fantastic." And in fact, Jack these days is becoming more apologetic about the things that he used to believe in terms of mammograms. At least personally, he's been that way with me. And I think he is publicly too with his colleagues. But he said to me, John, he says, I have 30 friends who all they do is read mammograms. They are not going to let this change the practice of medicine. Otherwise, they'd have no way to pay the kids' tuition, to pay the mortgage. They're going to do everything they can to keep their jobs. That's what he told me. And that's the truth. You know, I see it in every aspect of medicine. You know, study comes out, says heart surgery doesn't save lives with chronic heart disease. Well, you know, the bypass surgeons notice, the cardiologists note, and then they go on and do their surgeries. Just like the WHO report from last week saying that meat, and especially processed meat, causes cancer. The meat industry, they didn't even ruffle. I watched their responses. They said, well, you know, there's some important nutrients in meat that you don't want to miss. And this will be, it's probably already forgotten. And they'll just step up with a couple of new ads, put in a couple of new ads for the Super Bowl, or, you know.
Right.
It's just the money. It is. I think otherwise you're fooling yourself. There's nobody's out to get you.
Right. Well, Dr. McDougall, are you up for some questions today?
Sure. Yeah, let's do that. I know I ran along on my story. It's a very complicated and important story, but those of you who are interested in breast cancer, I can tell you it's one of the things that I know most about. I lost my sister-in-law to breast cancer when she was 28 years old. I lost my aunt to breast cancer when she was 56. So breast cancer has been in my family. I did the first dietary study on breast cancer, which was published in 1984. First study on the dietary treatment of breast cancer. And that will be in the February 2015 newsletter. A full copy of that study that I did and published is there.
Just to make sure, everybody, that you sign up for this free newsletter so that you can read what Dr. McDougall is writing.
You don't even have to sign up for it. Just go to the website and click on newsletter archives, and you'll find it there. You don't, but I do want you to sign up for it so you get the future ones. Thank you. But the ones that I've been talking about, the August 2014 on screening, the February 2015 on treating breast cancer, they're just a matter of going to the website. No charge. You'll find them.
Yes, wonderful, sir. Dr. McDougall, you mentioned family, and there are a few people that are asking, what if cancer is in your paternal or maternal side of the family? Should they worry about this? What can they do?
Well, there are some cancers that have a genetic predisposition, like the BRCA cancers, the BRCAs. This is something you were dealt in terms of your genes. But what hasn't been studied is how these genetic disadvantages, you may call them, play out when people eat a healthy diet. Maybe you have a tendency to get a squamous cell carcinoma of the lung because of family tendency. Well, what if you never smoked cigarettes? It would never come out.
Right.
And if you have a family tendency like the BRCA gene for ovarian and breast cancer, and you live in the Western diet, and as a result, you get a much higher risk of cancer of the breast and ovary. We don't know that. The same thing occurs in women who eat the kind of diet I recommend. Breast cancer was virtually unknown in Japan after World War II, or any place in Asia after World War II. I've had conversations with women that were alive at that time, and they never heard of breast cancer, never heard of a woman getting breast cancer. Same thing with prostate cancer. After World War II, in Japan, they can only find a handful of prostate cancers. So this idea that you have a genetic predisposition and you're doomed, I would like you to get that out of your mind quickly and do everything you can to fight off being a cancer victim. And one other thing I want to mention about genetics, a lot of inheritance that you get is from education. You learn what to eat and whether or not to smoke and whether or not to exercise. And you learn these things from your parents. That kind of heredity, you can change. The kind that's in your DNA, you can't change. Well, maybe that's not entirely true. There are changes that take place in DNA called epigenetics. And so maybe you can even change the DNA. This whole area about genetic cancers and how they play out, and do they play out in every environment? In other words, every pattern of food eating. This needs to be looked into. And my bet is when it finally does get looked into, if a woman has the BRCA genes or some other predisposing gene in a man, when they play out the whole scene, my bet is they're going to find that these genes do not express themselves, and the patients don't get cancer if they eat the kind of diet that people used to eat who didn't get cancer, such as people in Japan, China.
Exactly.
Other parts of the world, you'll see the same thing. Cancer, except in the wealthy people, you'll find cancer in the kings and the queens in the past. Otherwise, cancer is pretty much unknown.
Okay, very good. Dr. McDougall, there are several people in this call who have the same or similar question. Triple negative breast cancer, it's the aggressive kind. If stage 1 or 2, do you think that refusing chemo and radiation and just doing dietary changes is effective enough?
This is how I treat breast cancer, and I have for the last almost 40 years. I have been totally consistent. I have never hedged, apologized. The way I treat breast cancer, and and this is, the exceptions would be extremely few, is once detected, and I recommend it be detected casually, such as you're taking a shower and you feel a lump, and you bring it to the attention of a doctor. I do not recommend mammograms. I hope I've made that clear. And by the way, the American Cancer Society just came out this month and said that women should not be doing breast self-examinations anymore. The U.S. Preventive Services Task Force said that in 2010. Cochrane's been saying that forever. And you shouldn't be aggressively searching for cancer in your breasts by doing self-examination, et cetera, or having physicians do examination, which is what the recommendation is for physicians to stop teaching women to do breast self-examination. So you casually find a cancer, you're showering, you find a lump, get it looked at, you go to a competent surgeon who will take the tumor out with clear margins. If you don't get clear margins, then maybe you should go back and take a little bit more out so you get clear margins, because if you don't have clear margins, you're likely to have a tumor mass grow back. It won't change your survival. As I said, the game has already been played. If this is the kind of cancer that's going to kill, it's already spread. So, but you don't want the tumor to come back in the breast itself. And if you leave a little bit in there, it's going to grow back and cause you distress. So you take the tumor out with clear surgical margins. And I recommend that women consider hormone therapy. Hormone therapy. It's actually anti-hormone therapy. There are drugs that block the activity of estrogen. Estrogen promotes cancer. So we have a couple of drugs, tamoxifen and another class of drugs called aromatase inhibitors. So I suggest women take a look at that. They increase survival a little bit, 5 to 10%. Maybe worthwhile to take them, but they also have adverse effects such as osteoporosis and increased uterine cancer, et cetera. So it's something you might consider. There are other ways to decrease your estrogen in your body. There's one really terrible way to do it, which is to give cancer chemotherapy. That's the way cancer chemotherapy works. It doesn't, it's supposed to, but its effect is not going out and grabbing those bad cells and killing those bad cancer cells. The way it works is they give these drugs that kill the ovaries. They chemically castrate a woman. And we know that because the women who see the improvement in survival with chemotherapy are the ones that have a change in their menstrual period. That's an inhumane way to castrate a woman, to make her sick for a year and have her lose her hair. Then the other way that you can cut the estrogen levels down is you can have the ovaries removed. And that's something that some of my patients have done. A real big way to cut the estrogen levels down are to change your diet. Just changing the diet alone makes a huge difference in the amount of estrogen in your body. And then when you lose the excess body fat cells are little estrogen factories. Your estrogen levels go way down too. So you remove the lump with clear margins, consider an anti-estrogen approach, and definitely change to a healthy diet. I reserve radiation for local disease that cannot be controlled by a more conservative means, such as more surgery. Radiation is a big deal. You radiate the bones, you radiate the skin, and if it's on the left side, you radiate the heart and increase the risk of dying of heart disease. So radiation should be reserved for a last step in terms of controlling local disease. Sometimes women have to have mastectomies because the tumor is so big and the breast is so small. That's the only choice. But otherwise, a lumpectomy. Try to leave a woman with a physically well-appearing breast, the best that you can. Just do the surgery necessary and see if you can preserve her physical appearance as much as you can.
Right. You mentioned diet, Dr. McDougall, and many people have questions about if you could be a little bit more specific. Some people, I guess, are thinking that there are specific foods to prevent or reverse. What can you say?
Well, no, there isn't. There's not one diet for multiple sclerosis, right. Another diet for heart disease, and another diet if you're too fat. There's one human diet. And I, again, have been teaching this consistently for 40 years. I refer you to my website, drmcdougall.com, and go through the my color picture book, Dr. McDougall's color picture book on food poisoning and how to cure it by eating beans, corn, rice, and potatoes. It's in 22 languages. You can send it to your friends around the world. And that explains the diet that I have always recommended. It's a diet based on starches like corn and rice and potatoes and sweet potatoes and beans, with the addition of some fruits and vegetables. That's the diet. That's the diet that slows the cancer growth, encourages spontaneous regression of cancer in people who have a full body of cancer, which we quickly went through. That's the diet that cleans up the arteries. You see, it's this burden of the rich Western diet, the meat, the dairy, the oil, the candy bars, etc. It's the burden of that diet that causes injury and prevents the body from repairing. You take that burden away and you give the body its necessary ingredients to perform at its best, then what it does is heal. The body always wants to heal. Even if you have cancer every place, the body's still trying to heal. It has not given up on you. As I showed you in these various articles on spontaneous regression, which are as part of this presentation, and also in a full video that I believe is on the website. You'll just have to look through the website and see if you can find it. You'll see that even in the worst situations, it's not ever hopeless. It is in most doctors' offices because of the tools they have. You go to see a cancer doctor, and you ask the cancer doctor, "Is it okay if I change my diet?" And they'll look at you and they'll say, "Just don't lose weight." You would go, "What do you mean, just don't lose weight?" Well, see, cancer doctors have developed a way of thinking, a bias. They don't want their patients to lose weight because the last stages of their life are associated with very great weight loss. When you lose weight by eating healthy, that's completely different than losing weight because you're dying. But that's the kind of advice you'll get from most, 99.9, almost every doctor who deals with cancer. They'll say, "Yeah, you can change your diet, just don't lose weight." Well, based on the up-to-date report in the American Cancer Society report that came out in February of this year, officially, all doctors and dietitians should be telling their patients with cancer that they should be changing their diet in the direction I'm recommending. Of course, they should be telling their patients, all their patients, with or without cancer, they ought to be changing their diet.
Right.
But it's official now. If you have cancer, the American Cancer Society tells you to start eating better because then you will live longer. That's what they say. It's right there. You can read the report, my February 2015 newsletter.
Very good. Thank you, Dr. McDougall. What about, there's a question here by someone that says, "I would like to ask Dr. McDougall what advice he has for breast cancer patients who have BRCA1 gene variant. Is it the same as for patients without the gene variant? And if not, what are his recommendations?"
I didn't completely hear the question. This has been a very controversial thing. If you have this gene, whether or not you should have your breasts and ovaries removed. Angelina Jolie, she's been a big part of this discussion because she has this condition and has had both her breasts removed and is considered or already has had her ovaries removed. That's a course to take. It clearly reduces the risk of dying of breast cancer. But the question is, a little bit. But the question is, and I'd have to review this article that just came out, it showed that the survival benefits were only in those who had the survival benefits, only in those who had their ovaries taken out also. And remember, I told you a few minutes ago that you can improve survival by a little bit, let's say 5 to 10% in 10 years, by taking the ovaries out. Well, if the research paper I'm interpreting correctly, it said that in women with the BRCA gene, you did see survival benefit if you did pick off their breasts, but you also had to take the ovaries. And so you're getting the same type of effect of removing ovaries, whether you have the BRCA trait or you don't. I think that for me to give a stronger recommendation about women having the breasts and ovaries removed or not, I think I would have to become more of an expert to be any more definite than what I told you. And that is the benefits are from taking the ovaries, at least from this one study I was looking at, and that regardless of your genetic makeup, you should change your diet, regardless of whether you have the cancer or don't have the cancer or are going to get the cancer. I can be specific about that, but there's a lot written about the BRCA gene.
Right.
And a lot of controversy too, more than you are told.
I think that Dr. McDougall, in the future, it would be great if you could do another webinar, because we have so many questions and I don't want people to despair because their question wasn't answered. All the information is on your website, as you mentioned.
It is. I've written 2 books that contain chapters on breast cancer, and both of them, by the way, you can get from our ebook store. There are PDF downloads. The PDF downloads are $10 a piece. And so you can go there, you can have McDougall's Medicine, A Challenging Second Opinion, which is where the chapter came from. That will be in the newsletter that comes out on Sunday or Monday. That's free. Yeah, just hit the link. The other is called the McDougall Program for Women, which is also available from our e-store. So I've written 2 books on it. I did the first research on the dietary treatment of breast cancer. I wrote the dietary goals for Hawaii on breast cancer. I also got the 3rd law passed on informed consent in Hawaii. Informed consent means a doctor has to, by law, tell a woman about her options when it comes to breast cancer treatment. And this I did in 1982. It was the 3rd state. California, Massachusetts had laws forcing doctors to tell women they could have different ways to treat their breast cancer. Lumpectomy plus radiation, mastectomy. By law, they were told they had to do this. Now over 18 states have informed consent laws. Now, why would you have to pass a law to make a doctor tell a patient the truth that she's paying for? It's insane. Anyway, and by the way, mastectomy business is on the rise. Even though we have all this information, and we had laws passed in the 80s forcing doctors to tell them that you get the same survival results with a mastectomy or a lumpectomy, the business of mastectomy is on the rise. And you asked me why, Gustavo.
A good business. Well,
we're just doing business, folks. That's all.
Right. Well, Dr. McDougall, I think time is up, and we will see everybody next week when your wife Mary is going to share her knowledge about eating out and going out to people's homes and that kind of information.
Yes, we'll do it. Mary still, she has a smile on her face.
Okay, well, now it's official.
Anyway, it was a pleasure. Breast cancer is, as you can see, a great interest of mine for many reasons.
Very good.
Well, thank you for hosting this, Gustavo. You did a great job, and I want to explain to the people how much effort Gustavo has put into this. This is something we kind of dreamed up that we do just a couple of months ago. We were gonna become webinar people, and so he's had great pressure on him to master all of the tools and to get an environment together so that it would be pleasant for you. And it hasn't always been excellent. We made mistakes along the way. We'll continue to make mistakes, but we want to be good at this. We want to be able to, and both of us in our hearts have the same mission. And that is to share this message to the whole world and to hopefully change the world. It's not exactly going professional or excellent in the beginning, but we're getting better.
We are.
And we're having more fun. And the amount of work that you put into this, Gustavo, they do not appreciate, but I want to say now, and I'll mention it as often as I can remember.
Well, thank you for your kind words.
Well, let me finish this for all time official statement. If it wasn't for Gustavo, we wouldn't be having these webinars. He's the man who encouraged me to do it, said he'd set it up, help me do it, make it work for me. And that's really the truth. It was something I thought of many years ago, but never pursued. And until this man walked into my life, it would have never happened at any level. I don't.
Well,
thank you, Gustavo.
No, thank you. We all know how busy you are, Dr. McDougall, and doing this for free for people to just log in and spend time with you. It's amazing. Thank you so much.
Thank you. Bye-bye.
All right. Bye-bye.